Story 1. Sent a patient for an ambulatory sleep study when he was referred to us for suspected sleep apnea. He was very tired and apathetic when he came in. His test results showed an apnea-hypopnea index of 127, with the longest apnea episode lasting 77 seconds, indicating he was stopping breathing 127 times every hour. I called him back urgently to start a continuous positive airway pressure trial, which was later changed to a variable positive airway pressure trial. The last time I saw him, he was cheerful and about 35 kilograms lighter than when we initially saw him. Story 2. An elderly woman had a pulse rate of 8. I suspected the pulse oximeter was malfunctioning, as they often do, so I asked my coworker to remove it from the patient and check it on me instead. When my coworker used the pulse oximeter on me, it displayed a normal, healthy pulse rate almost immediately. We exchanged concerned glances and then looked back at the patient, realizing the situation was serious. Story 3. My mom was a type 1 diabetic. Her glucose frequently dropped at night while she was sleeping. I was home visiting and pregnant and had to get up to use the restroom frequently at night. Both my mom and I were sleeping on the sofas in the family room. I would take a whiff every time I walked by to the restroom. Once her glucose dropped, she would start sweating out the excess insulin. Low blood sugar sweats are something you can smell if you have been around it at night. She smelled low, and I had a hard time rousing her. I got the glucagon out and got her food. But just before I gave the glucagon, I checked her blood sugar. My dad was difficult about using the glucagon injections because it was costly for just 3 doses 20 years ago. I felt like I had to justify giving the glucagon. Her blood sugar was 12. It's a miracle the glucagon worked. I still had to give her soda and make a sandwich. I wish she had lived long enough to get a continuous glucose monitor. It would have completely changed her life. Story 4. I had a patient come in for an electroencephalogram. We chatted the whole time. The patient was very nice. I started the test, and they were having seizures every 30 to 40 seconds without realizing it. They had driven there. Story 5. Not technically lab results, but during intake, my best friend's pulse oximetry reading was 44%. The oxygen she was receiving was solely through agonal breathing at that point. She was immediately rushed back, placed in a medical coma, and intubated on life support for 4 days and in intensive care for 6. She had a severe combination of influenza, strep throat, and pneumonia. Needless to say, she was incredibly close to death, and it amazed everyone that she survived. Story 6. As a laboratory technician, I have encountered a variety of cases. The highest glucose level I recorded was 1750. The highest accurate potassium level was 7.9. The rule of thumb is that at 8, the situation becomes critical. Hemolyzed samples can cause false elevations, but that particular result was accurate. I discovered that our lactic acid analyzer only measures up to 40, and unfortunately, that patient did not survive. I have seen urine samples containing so many crystals that it was difficult to visualize anything else. Most recently, I analyzed a urine sample from an 89-year-old man that contained a significant amount of very healthy-looking sperm, and I was surprised by both the quality and quantity. Story 7. I had a 10-year-old boy come into the emergency room for his diabetes. The finger prick result was so high it couldn't provide a measure, indicating an extremely elevated level. The parents mentioned, he's always thirsty, but we only give him orange juice with no added sugar and shakes from McDonald's. For anyone unaware, both of these can act like pure sugar for someone with diabetes. Story 8. Common medical terms I have seen on this thread that people outside the medical field may not understand. Complete blood count. A test that counts the different cells in your blood, including red blood cells, which carry oxygen, white blood cells, which fight germs, and platelets, which help stop bleeding. Hemoglobin, the part of red blood cells that carries oxygen throughout your body. Low hemoglobin levels can indicate anemia, which can cause tiredness and weakness. Hemoglobin A1C, a test that shows your average blood sugar level over the past few months, primarily used for individuals with diabetes. White blood cell count indicates the number of infection-fighting cells in your blood. Elevated levels may suggest an infection or inflammation. Platelets, Small components in your blood that assist in clotting, preventing excessive bleeding from cuts. Lipid panel assesses the fats in your blood, such as cholesterol, to determine your risk for heart problems. Thyroid-stimulating hormone, a test that evaluates how well your thyroid, a gland in your neck that regulates energy and growth, is functioning. Aspartate aminotransferase/alanine aminotransferase, tests that assess liver health. Basic metabolic panel, a series of tests that monitor factors such as blood sugar, calcium levels, and kidney function. International normalized ratio measures how well your blood clots, especially if you are taking blood thinners. Story 9. I recently had a hemoglobin level of 5, and I overheard my nurse telling everyone at the nurse's station, "She went to work today," with a laugh. I don't know if this is extreme, but every nurse and doctor reacted by saying, "No wonder you're tired all the time." Story 10. Next week is National Lab Week. Thank you to all the unsung heroes in the laboratories. Many people mistakenly think that when a doctor runs some tests, it means the doctor physically conducts the tests. An entire department in hospitals produces this critical data. If you think nurses are underpaid, I have an update for you. These professionals hold college degrees but are often overlooked. When our hospital aimed for all employees to earn $20 per hour, there was no mention of raising the starting medical technologist salary above $23.25. I wonder what it is today. Story 11. I am not a medical worker, but I once frightened someone with a blood pressure reading of 60/40. I was 19 and felt completely fine, but the nurse triple-checked the reading before rushing out of the room to bring the doctor and almost the entire medical team into the room. Since then, I have been told I have chronically low blood pressure. Story 12. Addiction field. Liver function tests. Serum gamma-glutamyl-transferase is normally around 130. A patient's result was approximately 5,980 after consuming 3 bottles of red wine daily for many years. There is uncertainty about their current status. The concerning aspect is that when this result declines, individuals may mistakenly believe they are improving, but it could simply mean there are no liver cells left to measure. Story 13. Not a specific lab result, but one time I had to process a blood sample where the plasma looked like strawberry yogurt. Ideally, it would be almost clear. Story 14. Hemoglobin 1.9. The patient walked into the emergency room, admittedly dizzy but still walking, then refused blood transfusions. Blood glucose 1,472. This is a stage 4 gastric cancer patient with uncontrolled diabetes. He woke up and felt fine after a couple of hours on an insulin drip. Blood glucose 19 and rectal temperature 89.6. The same patient, nursing home staff reported he was fine 3 hours prior. Absolute neutrophil count 0.0. He came in for a fever. Lactate 14. This was my grandmother a week before she died of sepsis and pancreatic cancer. Blood pressure 312/199. A large man slipped in the shower and hit his head, experiencing a brain bleed the size of a baseball. He was still awake but very confused and agitated. He received clofidipine. Troponin levels were above 23,500. I was unaware our laboratory had an upper troponin limit. Blood alcohol level was above 0.6, maintained every day for 3 years straight. Story 15. I am a resident here, and our clinic often has patients who get lost to follow up. A patient came in just under 2 years after his last appointment, where it was revealed he had a ferritin level of 1. I repeat, a ferritin level of 1. The poor man also had hemorrhoids and reported bleeding every day, along with continuous fatigue. Nothing to replenish his hemoglobin stores. The unfortunate part is that the ferritin level was from a while ago, and he never followed up for intervention. We are on track now, though. Story 16. Triglycerides of 5,335. Does it count if I am the patient? They said they could see it in the tube before testing. Story 17. I once encountered a person with a platelet count of 2. It is not how it typically works, but I often thought about just 2 single platelets floating around. Sadly, he bled out the same day. Story 18. As a family member of the patient, I once had a relative test for a hemoglobin A1C of 19.2%. The ideal normal range is under 5.7%. The staff at the hospital sounded both surprised and a bit horrified when they informed us of that result. Story 19. As a lab scientist in Australia, brown snake envenomation always provides interesting results. I had a 22-year-old male who developed disseminated intravascular coagulation following a brown snake bite and died with a hemoglobin level of 22. He was a Jehovah's Witness and refused a transfusion. Story 20. I am not a medical professional, but I have a mechanical mitral valve, so I have to be on warfarin for the rest of my life. I told my friend, who is a clinical pharmacist, that my dose is 14 milligrams, and he was surprised that I wasn't bleeding out at that moment. Apparently, I consume a lot of vitamin K, which is why I need a high dose. My international normalized ratio INR is usually 2.0. Story 21. Not a medical worker, just a patient. I went in for a follow-up after an emergency room visit, and the creatine kinase test result came back at 212,000. After being admitted, a few more of the same tests were unreadable. I pulled both thigh muscles and ended up with rhabdomyolysis. This was the beginning of my journey to the Mayo Clinic for a diagnosis of McArdle syndrome. Story 22. The person who refused a blood transfusion had a hemoglobin level of 3.4, while the normal average is around 14. Typically, we perform a transfusion when the level is below 7. Story 23. Once I had a positive flu test. However, the lab technician typed it incorrectly. I had some real fun hanging out with the nursing student during that shift. Story 24. Not a worker, but a patient. I had been suffering from chronic diarrhea and stomach cramps for months. While waiting for yet another appointment with a gastroenterologist, I developed a high fever. I tried treating it with acetaminophen and ibuprofen, but after about a week, they were ineffective. I left work early on a Thursday and informed my boss that I wouldn't be in the following day, then went home to rest. After taking a large amount of acetaminophen and ibuprofen and soaking in a lukewarm bath for an hour, my temperature was still 103 degrees Fahrenheit. I decided to go to bed and planned to visit the emergency room if I didn't feel better in the morning. I woke up in the hospital on Saturday. Unexpectedly, my mom stopped by to see me and found me unresponsive in my bed, soaked in sweat and feces. They rushed me to the hospital by ambulance, and I had a fever of 105 degrees Fahrenheit and a blood pressure of 60/40. They packed me in ice packs and initiated a sepsis protocol. I was severely dehydrated and had poor kidney function due to the low blood pressure, requiring 4 liters of saline before I produced any urine. It turns out I had been suffering from severe Crohn's disease for months, with a perforated colon causing all the other symptoms. I share this story because the nurses all agreed they had never seen anyone with such low blood pressure survive. Story 25. My friend was feeling unwell and tired. He went to the emergency room, and his oxygen level was 51%. He thought that was acceptable because he believed 51 was passing. It turns out he had a spontaneous pneumothorax, which is when one lung collapses. He was also tall, thin, and pale, which many people with spontaneous pneumothorax often have as well. Story 26. I've had a couple of strange experiences. It was the best I had ever felt in my life. I lost 60 pounds in 6 months with no significant changes. The doctor said to keep it up. I suggested, maybe we should test for something. I was concerned about cancer. A blood test revealed my blood glucose level was 880, and my A1C was 13.2, so diabetes. I went in with severe cramping. Blood tests showed my leukocyte count was over 30,000. It was an immediate emergency. They suspected my pancreas was shutting down. An ultrasound revealed large gallstones. I spent several days without food, trying to help my pancreas recover. On the 3rd evening, the nurse, whom I still refer to as Ratched, came in and said, "They aren't going to perform the surgery. Your leukocyte count is still too high." I became frightened and asked, "Oh no, how high is it?" 5,000, she replied. My wife and I started laughing. "Don't laugh. You could die. They were over 30,000 when we arrived. Don't you lie to me." she insisted. Oh, please go check. I don't want to be mistaken. That's what they said and what I remembered. She returned a few minutes later with good news. They will perform the surgery tomorrow. That was the last time she spoke to me. They removed my gallbladder the next day. Story 27. Not a medical worker, but after one of my children was born, my ferritin level was at 4. The midwives thought the result was wrong and tested again on a different machine, which gave them a level of 3.8. Normal is apparently over 13. Anything under 8 and they start to consider a transfusion. They said it was surprising I was still mobile and not feeling too bad. After several units of blood and a day in the high dependency unit, my level increased to 7. When I returned for a booking appointment a few years later, I mentioned that I had a transfusion but had felt fine. The midwife said, "We had someone a few years ago who went down to under 4 and she was still managing well." Yes, that's probably me. Story 28. A friend of mine had a glucose level of nearly 950. When the technician took the sample, his face went pale and he said, "That's not good. I need to get the doctor." It turns out the feeling he had over the last few days wasn't the flu. It was sugar accumulating in his body. For reference, normal glucose levels are supposed to be between 75 and 100. I have been to the emergency room several times, and I have never seen a doctor react like that before when she entered the room. The wild part about all this is that he was diabetic for about 3 months, then his body figured itself out and he didn't need to take insulin anymore. He just watches what he eats and tests his blood sugar once a week. Surprising. Story 29. A sodium level of 555. Yes, you read it right. We looked at him. He replied, "I don't feel so good." And then he collapsed. I will never forget it as long as I live. Story 30. Reading a bone marrow aspirate revealed histoplasmosis capsulatum. Everyone related to hematology was in my office that day. Many extra slides were pulled and stained for personal collections. Story 31. My then 15-year-old daughter needed a bone marrow biopsy to investigate some abnormalities with her blood counts, and both samples obtained were pale yellow. They took one sample from each of her hips and found a total of 2 living cells. The remaining cells were dead and completely unidentifiable. Apparently, they can sometimes determine what dead cells used to be, but we were told, "We don't know what's going on." But this isn't a good sign. They attempted again, taking 5 samples from each hip. There were no living cells whatsoever. They then decided to try sampling other bones. The sample from her upper arm was also completely dead, but the one from her shin was not. It was, however, 94% leukemia, acute myeloid leukemia. That was in 2018. She spent most of 6 months in the hospital but made it through and is doing well now. Story 32. I am not a medical worker, but I am in the intensive care unit with my son. The doctor is discussing elevated liver enzymes, which are around 400, but he mentioned having a patient with levels at 1,000 who ended up okay. I traded places with my mom to take a shower, and I received a text that my son's levels were over 7,000. I definitely started panicking. Story 33. A tortuous herniating stroke occurred. The brain twisted clockwise from the left temporal region and herniated through the foramen magnum. Symptoms included a headache and dizziness lasting for 45 minutes. Story 34. A blood sugar level of slightly more than 240 was recorded, with normal levels being between 70 and 100. The patient had a history of uncontrolled diabetes and unfortunately passed away at the end of that hospital stay. She was only in her 30s. Story 35. I took my child to the pediatrician for a checkup. The blood pressure readings were high, specifically elevated enough to be classified as stage 2 hypertension. They took multiple measurements with different instruments to confirm this, which was very concerning. We received a home blood pressure monitor and instructions. I called the school nurse to discuss monitoring during the school day. After the appointment, my child rushed to the bathroom, having been unable to go for a while and really needing to use the restroom. Everything turned out fine. Story 36. I once received a direct call from the lab after a blood test, and the technician asked me if I was alive and urged me to go to the hospital. It was during my chemotherapy cycle, and apparently my neutrophils had dropped to a very low level. Story 37. Once, I drew blood from a parrot that looked like scrambled egg yolk. Very thick and yellow. Generally, bird blood looks similar to human blood. I don't remember the results of the blood work, other than that its liver was damaged. Story 38. I was the doctor covering a psychiatric hospital on the night shift. At the tail end of the shift, around 6 a.m., nurses from one of the old age wards called me, saying one of their patients had been complaining of chest pains since midnight. They didn't want to reach out at that time as they didn't think it was serious enough to disturb me. I checked on the patient, and he looked calm while saying his chest had been hurting a bit overnight. I took a heart tracing which showed global ST elevations, indicating a severe risk of heart attack. I took a blood sample to check troponin, a chemical used as a biomarker for measuring heart damage, and sent the patient to the nearby general hospital as quickly as I could. That blood sample showed a troponin level of around 10,000 Ing/L. For reference, a normal healthy reading is 0 to 14. I made it clear to the nurses afterward that it is my responsibility to be disturbed if someone is complaining of chest pain, no matter how minor it may seem, even at odd hours. Story 39. I received a call from the doctor asking if we had life insurance on my husband because his triglycerides were 2,600. The lab had retested multiple times. This was 25 years ago, and he still struggles to keep them in the 3-digit range with very expensive medication. Story 40. The normal range for adjusted calcium in my lab is less than 2.59 millimoles per liter. I once encountered a patient with a level of 6. I didn't realize that having chalky blood was compatible with life, but after administering a large amount of intravenous fluid and a dose of bisphosphonate, she was still there to tell me she hadn't had a bowel movement for a week. I also once had a patient with lipemia-induced pancreatitis. Her blood appeared white with a slight blush in the tube. It quickly settled into layers, with the top 3/4 being lipid. I do not know what her triglyceride level was because our lab's kit returned a value of 3.6 Roentgens per second and sent the sample to a central lab for testing. I went on holiday the next day and forgot to follow up when I returned. Story 41. I had a child who I sent for a sleep study. He was desaturating to the 50s and was admitted directly from the sleep lab to the intensive care unit for an emergency tonsillectomy, which was done the next day. This changed his entire life. His previously debilitating anxiety vanished. Story 42. I received a call from the laboratory technician that my patient had blue-green crystals. The technician mentioned that when these appear, death is usually imminent. The patient passed away about an hour later. Story 43. I am a veterinarian, and we use hematocrit instead of hemoglobin because it is more accurate across species. A puppy came in oxygen-dependent from flea and parasite anemia. His hematocrit was 4%, meaning only 4% of the fluid in his veins was red blood cells. It looked like red-tinged water. Normal levels are supposed to be 35 to 55%. I treated the fleas and administered a few milliliters of blood. He was tiny. And in about 30 minutes he was bouncing off the walls because he could breathe again. Story 44. Hemoglobin of 2. I thought it must have been extremely diluted or that I had missed a clot when I ran it. I called down to the emergency department for a recollection. It was 2 again. I called one more time to talk to the nurse. This result is incompatible with life. Are you sure it was drawn below the intravenous line and that it's not contaminated? Oh no, 2 makes sense. The patient is covered in bed bugs. We pumped 4 units of blood into the patient, but they still didn't make it. The patient was severely infested with bed bugs. Story 45. Blood alcohol level of 0.587 or 0.59%. To put it in perspective, that man was more than 0.5% alcohol. Story 46. I met a doctor who was very excited to see me because she had read my medical history and had never met anyone with a lipase level over 4,000 before. Story 47. I'm not a medical technician, but I am a phlebotomist. I had a child with blood that was so thin it looked like a Halloween prop. When I dropped off the sample, the medical technician did not believe me when I told them it was real and not just me covering up a mistake. I don't know what that child's hemoglobin level was, but it was dangerously low. Low enough that the same medical technician was surprised the child was alive. I have never seen blood so thin before in my 11 years in this job. It was like red-tinted water. Story 48. I'm not a medical worker, but I did give my doctor, in his words, a small heart attack. I had pneumonia and went to the doctor. They decided to do a chest x-ray. At the time, I was wearing a necklace that was very dear to me, a gift from my brother. It was basically a bunch of rope tied into knots with a pendant made of bone. The x-ray technician told me to take it off, and I explained that it wasn't coming off unless she brought scissors. The knots were everywhere, and I couldn't get it over my head. She made a gesture that I interpreted as, "You know what, never mind." So I just tossed the necklace over my shoulder and went ahead with the x-ray. Some time later, I got called into the doctor's office. He was sitting there, visibly shaken. He told me I had cancer, then showed me the x-ray, which had a solid black mass near the top of my lung. I panicked for a moment, but then I realized the shape looked familiar. After connecting the dots, I explained what had happened and even showed him the necklace. Turned out to be no cancer, just plain misunderstanding. We both laughed nervously at the situation. Story 49. I was getting an electrocardiogram at the Cleveland Clinic. My heart rate was 38. After the technician removed the leads, he said, I'll be right back. I have to go talk to someone. For some reason, after a couple of years on my heart medication, they started causing this issue for me. They took me off the medication, and my heart rate returned to normal. I never felt dizzy or affected by the low heart rate. Story 50. A genetic test confirmed the patient as XY, despite having a clear vulva and no penis. We sent a second blood test to a different laboratory to ensure there were no errors, and there were none. The child was male but presented with a vulva and no penis. Gender is truly a spectrum. Story 51. I walked into the emergency room with a white blood cell count of 30,000. I actually drove myself to the emergency room, unaware that I was septic due to having a flesh-eating bacteria. Story 52. Not a medical worker, but a patient who shocked his doctors. I managed to hit my head on the landing while hurrying up the stairs, taking a chunk out of the brickwork. I felt fine except for the pain at the impact site. A few hours later, I went to work and, as I was starting my shift, I collapsed on the floor, according to the team member I had been talking to at the time. After one ambulance ride and an x-ray, it was revealed that I had what could best be described as a spiderweb of hairline fractures across my skull from the impact. I took 5 months off work for the concussion to heal and for the fractures to repair themselves until I was declared fit to work, although I still had to take it easy. I returned to work to a lovely welcome present from my caring team, a bike helmet and multiple boxes of painkillers. Story 53. I work in clinical trials. A patient came in last week for routine blood work, and his creatinine kinase level was 7,800. He felt fine, surprisingly. I work in gastroenterology and have seen fecal calprotectin levels in the 8,000s range as well. Story 54. A few examples that come to mind. A blood glucose level of 1100 and a pH of 6.98 in an elderly man who is sitting alert and oriented, conversing with me as if everything is fine. Given those lab results, he should have been lethargic, confused, and barely able to open his eyes. A white blood cell count of 0.1 in someone undergoing chemotherapy induction. A hemoglobin level of 3.6 in a woman who walked into the emergency department and reported feeling very tired lately. Triglycerides exceeding 1200, the maximum reading of the instrument. You could see the fat in the laboratory tube after the blood draw. Story 55. My dad was sent for scans of either his gallbladder or appendix. I don't remember which. They performed the scan and sent it to the surgeon electronically. About an hour later, the surgeon himself called and said he was on his way to the hospital. My dad needed to come immediately for surgery because it was about to burst. A friend who works in the lab mentioned that the surgeon came down and expressed his anger because it was clear that surgery was urgently needed. They should have called and informed him that there was something requiring his immediate attention instead of waiting for him to find time to review it. Story 56. Not a medical worker, but my dad once had a blood sugar level issue in the 1980s. I spent 2 days sitting with him as he received treatment in the intensive care unit. Everyone thought I was lying when a new doctor or nurse would come in and ask about his blood sugar. I was told I must have misunderstood. They would try a finger poke, it wouldn't work, and they would have to send my dad's blood to the lab, which would come back outrageously high. Apparently, he should have been quite deceased. He received last rites and everything. He is 87 now, still diabetic, still going strong. Story 57. CK of 150,000. A girl took a spin class, and now her legs are very sore, and her urine appears unusual. Hemoglobin is 1.9. Potassium level is 9, not hemolyzed. Coded immediately. Story 58. An emergency medical technician here. I once encountered a patient with a blood pressure of 60/40ths. The unusual part was that he was talking, laughing, oriented, and acting as if nothing was wrong. It was quite strange. Story 59. Worked in hospice for a time. I made a joint visit with the registered nurse. The patient's pulse oximetry reading was 18%. They were awake, completely oriented, and talkative, with no shortness of breath or any other symptoms. The highest reading during the entire visit was 25%. We kept experimenting on ourselves with different fingers, and the nurse even tried our toes. The readings on us were all normal. We directly communicated with the patient and family, expressing that we were uncertain how the patient could be awake and engaging with us, but we believed their time left was limited. The patient and family were extremely understanding. They lived for another 18 hours, talking and visiting with family before ultimately passing peacefully in their sleep. Story 60. My husband, at 33 and with no extra weight, stopped breathing about 70 times per hour. He has worn his continuous positive airway pressure machine religiously for the past 20 years. He falls asleep with his mask on, and I am in bed with my retainer and a skincare mask on. We are the sexiest middle-aged couple ever. Story 61. I am not a medical worker, but I am diabetic, so I have to check my glucose frequently. Once at work, I was checking my levels before lunch, and a coworker who hadn't been feeling well asked me what I was doing. So I explained. She was young and in good health but was curious, so we checked her glucose too. It was 16. Story 62. My results showed no platelets. This was followed by a diagnosis of leukemia, along with several years of chemotherapy. Story 63. Last year, I was admitted to the hospital due to a reaction to my immunotherapy, which caused severe dermatitis from head to toe that required intravenous steroids. I felt terrible. During one of my routine observations a couple of hours after lunch, the nurse measured my blood glucose and found it to be 2.4 millimoles per liter. She said, "Oh, that's low. How are you still conscious?" She asked how I was feeling, and I replied that I felt pretty bad, just like I had the entire time. She gave me some sugar syrup from a sachet and then measured my blood glucose every 2 hours for several days until it stabilized. Story 64. The two cases I can recall involve a potassium level of 1.2 milliequivalents per liter that came in from an outside facility. I rolled my eyes and called to inform them it was contaminated, as there is no way someone can have that level and be alive. They brought the patient in, a young man in a wheelchair, who seemed perfectly healthy and was confused as to why he had been brought to the emergency room. Our staff redrew his blood, and he had a potassium level of 1.3 milliequivalents per liter this time. It turns out he has hypokalemic periodic paralysis or something similar. As long as his potassium level is low, he cannot use his legs. The second case I recall involved a blood culture that went positive after only 4 hours on Thanksgiving, which is very unusual. Our biofire system did not identify what it was, but only the anaerobic bottles tested positive. The emergency department called the patient's family and told them to bring her back in. The family waited until after dinner, about 3 or 4 hours later, to go to the patient's house, where they found her in a chair, completely out of touch with reality. They brought her in and we drew labs. We spun the sample down and took it out of the centrifuge, thinking we might have forgotten to hit start because the entire tube was dark red. We respun it and it remained the same. We noticed the gel separator was in the middle, but both halves of the tube looked like whole blood. Our technician, who used to be a microbiologist at her previous hospital, saw this and exclaimed, "Clostridium perfringens." We called the pathologist and tried to get the emergency department doctor to consult him. Unfortunately, the several-hour delay caused by the family resulted in her passing away. When they were first in, she was just feeling a little sick and had vomited at work. They did not make it. It was total Clostridium perfringens sepsis. Story 65. I work in the catheterization lab, where we check the coronary arteries of patients and place stents or fix blockages if needed. We also address heart attacks and a number of other conditions. My coworker's 57-year-old father was experiencing occasional chest pain. The patient was quite thin, a non-smoker, but my coworker, his son, convinced him to undergo a catheterization procedure. The coworker came to me personally and requested that I be assigned to the case, which felt like a great honor. There are 3 arteries that supply blood flow to the heart, starting as 2 in most individuals. The right coronary artery feeds the bottom of the heart, while the left main artery divides into the left anterior descending artery, often referred to as the widowmaker, which supplies the front of the heart, and the left circumflex artery, which feeds the back and side of the heart. My coworker's father had a 99% blockage in the left main artery, which also extended into a 99% blockage at the beginning of the left anterior descending artery and the left circumflex artery. It was one of the most severe blockages I had ever encountered, made more intense by the knowledge that the son could see exactly what we were observing. We worked quickly to insert a cardiac support pump and transferred him to the intensive care unit, where they performed coronary artery bypass grafting the next morning, a Saturday. While stents were an option, the risk associated with the severity of the blockage was too great. If something had gone wrong, at least 2/3 of the heart's blood supply would have been compromised. Fortunately, the surgery was successful and he is doing well. It was a moment that made me realize how much I truly care about my coworkers. Story 66. I have a record in my phone. 1. A 1C20.1. 2. Body mass index 115. 3. Lactic acid 31. 4. Platelets 5. 5. Lactoferrins 6,780. 6. Triglycerides 10,080. 7. Sodium 183. Ammonia 538. Story 67. 14 Indian rupees. Left ventricular assist device patient. All on Coumadin. Therapeutic range is 2 to 3. WBC 0.1. Cancer patient with metastases. Platelets 4. Likely another cancer patient. Source: nurse with experience in various patient populations. Currently in a medical surgical intensive care unit. Story 68. Obligatory, not a medical worker, but I was once brought into the emergency room with a heart rate of 32, blood pressure of 60/40ths, and a temperature of 34 degrees Celsius. It turned out to be a bowel blockage that thankfully resolved itself without surgery. I overheard one of the nurses say she had never seen that much waste come out of a person. Please consume enough fiber and drink plenty of water. Constipation is not to be taken lightly. Story 69. A woman with hypertension and severe depression stopped taking her medications due to suicidal thoughts. Her blood pressure was 330/180, and she refused any treatment. I was shadowing a doctor at the time, and I believe his blood pressure was similar. He was working with a serious health risk. Story 70. Our daughter has complex developmental disorder type 2. This is the first time the children's hematology department has encountered it. It is apparently quite rare. None of the labs really figured it out until the genetics results came back, and everyone was surprised. Story 71. I was in the emergency room for not feeling well for a couple of days. I asked the nurse to open the window because I felt a bit warm. It turns out my temperature was 43.9 degrees Celsius, which is 111.02 degrees Fahrenheit. She rushed out to get a doctor. Story 72. Hemoglobin 4.2 and largely asymptomatic, chronic with heavy periods. Fasting blood sugar 17 in a young woman with no previous diagnoses. Story 73. Not in the lab, but when I was a medical assistant, I roomed a regular follow-up patient. His last pulse and electrocardiogram were normal. When he came in that day, his heart rate was 35 on the pulse oximeter. I almost panicked but realized he was calm, sitting upright, breathing normally, and not in distress. I performed an electrocardiogram in the room, which showed he had developed a type of heart block. The doctor conducted his follow-up, and then he drove himself to the emergency room. Story 74. I am not a medical worker. I am a flight attendant, but I had an elderly passenger whose blood oxygen level was 77%. We thought the machine was broken. Story 75. I felt dizzy after leaving the gym. It was worse on the train ride home. I went to the nearest emergency room, and my blood sugar was 32. I am not diabetic. Story 76. From a metabolic inpatient unit, we observed issues with the patient's lipids even before the sample was sent to the laboratory. The blood was not red. It resembled the color of pink milk. Story 77. I recently had my vitamin D levels checked. The normal range is 40 to 50 international units per gram. Mine was at 2. Story 78. I attempted to take my own life with 16 milligrams of Xanax, 100 milligrams of Valium, and 700 milliliters of vodka. I woke up just 5 hours later in the hospital, and with a very concerned expression, the doctor informed me that the concentrations in my blood could have killed 5 people. It took considerable effort for me to undergo genetic testing, and I have 3 unusual genes on chromosomes 13 and 19 that make me almost immune to many drugs, antibiotics, and alcohol. They conducted a free genetic test because they were curious. Story 79. Not a medical worker, but my dad was diabetic and liked to pretend that he wasn't. The only precaution he took was drinking diet soda. It was normal for us to find his blood sugar anywhere from 300 to 700. He passed away about 2 years ago after several years of dialysis and dealing with the struggles of kidney failure, which, from what I can tell, is like constantly having a terrible stomach flu. Take your diabetes seriously, people. Story 80. As the patient, I had a vitamin D level of 7. The low end of normal is 30 nanograms per milliliter. I felt fine while my nephrologist stared at me in disbelief and said, "So we're going to start you on that." I took a high dose of vitamin D, 50,000 international units, for about a year before my levels reached the low 30s, at which point I was switched to a maintenance dose. Story 81. Reading all these stories, I am beginning to understand why, in the past, people would sometimes just drop dead out of nowhere despite appearing perfectly healthy. One could only assume it was demons or witches that were responsible. Story 82. In college, I volunteered at a shelter for homeless individuals struggling with alcohol addiction. The police would bring in people they found on the streets, and I would check their vitals and get them into a bed. One man walked in, seemed sober, and then had a blood alcohol content well over what I had been taught was a lethal level. He appeared fine, walking around and chatting as if nothing was wrong. Story 83. Had the lab call results on a patient. She stated, "I have been looking at blood sample slides for years, and this was the first time I saw something crawling around. The patient had protozoa in his blood. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye."